Hello everyone, welcome to Veterinary Small Talks. Today we are going to discuss fluid therapy. In fact, fluid therapy is a very large and elaborate topic, so I plan to do 2 or 3 videos on fluid therapy. So this is going to be just an introduction to fluid therapy. What is the primary aim of fluid therapy? Primary aim of fluid therapy can be classified into two. The first one is to correct hypoperfusion and the second one is to correct dehydration. So let's understand first the concept of hypoperfusion and dehydration before we go into fluid therapy. Imagine a healthy cardiovascular system with all its healthy blood vessels supplying oxygenated blood to all the tissues, supplying nutrients to the tissues, and then taking away the metabolic waste products away from the tissues. Suppose, imagine if there is an inadequate blood supply to a particular tissue, what can happen? There is a lack of oxygen delivery to that tissue, there is a lack of nutrient supply to that tissue, and there is a lack of clearance of the metabolic waste products away from the tissue. So this can result in what is called as tissue injury. Hypoperfusion means this situation where there is an inadequate blood supply to a tissue. So there is an inadequate oxygen supply to a tissue. The tissues are forced to undergo an anaerobic metabolism wherein lactate is produced. There is a lack of nutrient supply to the tissue and there is a lack of clearance of metabolic waste products away from the tissue. So depending upon the end organ or the tissue that is being affected, the effects of hypoperfusion can vary. For example, if the case of kidney, it can lead to acute kidney injury. If it is a tissue like lung, it can lead to acute respiratory disease syndrome. Imagine if it is our brain, it can lead to cerebral edema and it can lead to symptoms like seizures and coma. If it's a skin, it can lead to edema. So depending upon the tissue that is being supplied, the symptoms that is caused by the hypoperfusion can vary. So let's imagine how the hypoperfusion can happen. Hypoperfusion can happen when the volume of the blood is less, as in a blood loss that is occurring inside or outside the blood body, as in hemorrhage. Hypoperfusion can happen when the blood is being pooled somewhere else, which is called as third spacing. It can happen when the cardiovascular system is not conducting, or it can happen when the heart is not putting out its cardiac output. It can happen when there is an anaphylactic shock and there is a volume to size mismatch between the blood and the blood vessel. It can happen in septic shock wherein there is an anaphylaxis that is happening. It can happen in endotoxic shock wherein the endotoxins of gram-negative bacteria are released in circulation and that can cause a sepsis. So there are different mechanisms by which hypoperfusion can happen. To sum up, we can say that hypoperfusion is more or less an intravascular process, that is, it happens inside the blood vessel. Now let's discuss about dehydration. So you can see the image in my background. This is a typical tissue, this is a blood vessel, and these are the typical cells. So the space inside the blood vessel is called as intravascular space. This is the place where the hypoperfusion is affected. The space between the cells is called the interstitial space, and the space inside the cells is called the intracellular space. So dehydration affects the interstitial space. So when we give a fluid to correct dehydration, we are basically aiming at a fluid which can escape out of the intravascular space into the interstitial space. That is why we are using isotonic crystalloids to correct dehydration. When we do a fluid therapy to correct dehydration, we are necessarily making a connection with the intravascular space, but we are aiming for a fluid that can escape into the interstitial space and replenish the interstitial space. Whereas to correct hypoperfusion, when we are connecting a fluid, we are aiming for a fluid that necessarily stays inside this intravascular space. So to correct dehydration, we are aiming for isotonic crystalloids, which immediately escapes into the interstitial space, solves the fluid imbalance that is there in the interstitial space. But when we are giving a fluid to correct hypoperfusion, we are giving hypertonic fluids or hypertonic saline along with colloids that can stay inside the intravascular space and create a positive pressure inside the intravascular space. So how can we identify hypoperfusion on physical examination? The first one would be prolonged CRT or capillary refill time. So ideally in a healthy individual it should be less than two seconds, but in hypoperfusion it can be more than that. Then we can see the strength and the amplitude of the pulse. Of course, we can check the heart rate, we can check other parameters like the lactate concentration. So lactate is produced by the anaerobic metabolism. So when there is hypoperfusion, there is a decreased oxygen delivery to the tissues and there is anaerobic metabolism. So there is an increase in lactate production. So lactate production is a good indicator of hypoperfusion. On the other hand, dehydration is checked by skin tending, the lack of moistness in the mucous membrane, the lack of retraction of the globe into the orbit, and so on. So we can assume that a hypoperfusing patient is not hemodynamically stable. That patient is in shock, whereas a dehydrated patient is more or less hemodynamically stable. Consider a dog or cat hit by a car 1 hour before. So there is a splenic fracture. So there is a bleeding occurring inside the body. There is blood accumulating inside the peritoneal cavity. So this patient will show a prolonged CRT. This patient will show tachypnea, tachycardia. This patient will show an increased lactate concentration. This patient will show all the symptoms of hypoperfusion. But in this patient, there is no reduction in the net water content of the body. So we can say that this patient is hypoperfusing, but it is not dehydrated. So this patient requires fluid at a shock dose. Consider the case of a dog suffering from parvoviral enteritis. There is vomiting and diarrhea, so there is continuous loss of water content from the body. That patient is dehydrated. It will have prolonged skin tenting. It will have all the classical signs of dehydration. Or let's consider another case. Consider a cat suffering from chronic kidney failure. This patient shows polyuria and loss of water content from the body. So a cat suffering from chronic kidney failure will be dehydrated, but this cat will be hemodynamically stable. So this is the basic difference between hypoperfusion and dehydration. So our speed of the fluid and the rate of administration and so on have to be adjusted. Selection of the fluids has to be taken into consideration depending upon what situation that we are treating. We will discuss all these conditions in detail in the coming videos. So thank you for watching and bye bye.